Hello, my name is Boyd Shepard, and I am faculty here at the University of Texas Health Science Center at Houston School of Dentistry. I am a director in the Office of Professional Resources located in the PACE Center, Office of the Dean, and I am also a clinical associate professor in the Department of General Practice and Dental Public Health. I've been practicing law since 1994 with a practice exclusively tailored for dentists in Texas regulatory and business law. And I've been faculty at the UT School of Dentistry since 2007. I received no financial benefits that would create a conflict of interest or restrict my independent judgment with regard to the content of this presentation. At any time while viewing the video streaming course, you can take a break by simply pausing your computer. At the completion of this section, you will be asked to take a short exam in order to complete the requirements for streaming video courses. At the time, you will receive instructions regarding taking the exam. This online course is designed for dental practitioners to gain a greater understanding of the Texas Dental Practice Act and the rules and regulations of the Texas State Board of Dental Examiners, specifically TSBDE Rule 108.8, Records of the Dentist, so that they may implement the appropriate changes and systems in their day-to-day practice that ensures regulatory compliance with these rules and laws. Through understanding and implementation, the participant will also be managing the risks inherent in modern dental practice. Upon completion of this course, the participant will review, understand, and be able to apply the relevant provisions of the Texas Dental Practice Act and the TSBDE rules and regulations. Be able to apply TSBDE Rule 108.8, Records of the Dentist, the focus of this presentation. Value ethical and legal approaches to clinical dentistry in your own practice, and review and implement the risk management procedures and protocols that will prevent patient complaints to the Texas State Board of Dental Examiners. Okay, let's get started. Dental Practice Risk Management through Regulatory Compliance, Part 2. TSBDE Rule 108.8, Understanding and Implementing Proper Care of the Records of the Dentist. Before we get started into the actual Rule 108.8, for risk management purposes, it's important to point out and understand that the State Board of Dental Examiners in Texas performs three primary functions: licensing of dentists and dental hygienists, annual registration of all dentists, hygienists, and labs, and enforcement of Texas laws regulating the practice of dentistry. With respect to enforcement, this is the area where we will focus with the perspective of managing our risks. In order to most effectively manage your risks, it is important to know not only the rules and the laws themselves, but where you can access those rules. To access the rules and the law that regulate your license, the most efficient way to access those rules is by simply doing a search online in Google, for example, with the search words Texas Dental Board or Texas Board Dental. At this particular website, you will be able to find and access the Dental Practice Act, the Texas Administrative Code, which is where you will find the board rules, board policy statements. For example, the board's policy statement with regard to a dentist's use of Botox. There will also be frequently asked questions, which is a great resource for many topics that are commonly asked about by dentists in Texas of the board, as well as forms produced and distributed by the board to assist Texas dentists in being in compliance with the laws and rules. Caution: new rules are always being proposed and implemented without notice to you. This is another great reason to check the State Board of Dental Examiners website often, bookmark it, and understand that this is one additional step in managing your risks in day-to-day dental practice. To keep up with the rules and the rule changes and any new rules that may be implemented, you can also subscribe to the State Board of Dental Examiners newsletter at this email address. When you Google or search for the Texas Dental Board, the first link that should pop up should take you directly to the State Board of Dental Examiners website. There, as mentioned in the previous slide, you can locate and find new rule proposals that are being considered by the State Board of Dental Examiners. For the current laws and rules, on the top menu bar under the heading Laws and Rules, you will find a down menu that will take you to the Dental Practice Act as well as the State Board rules. So again, simply type in Texas Dental Board. Go to the website for the Texas State Board of Dental Examiners, click the main top bar menu, Laws and Rules, and locate the link either for the State Board rules or recent rule adoptions, whichever you may be looking for. And that will take you, for example, for the State Board rules to the page that allows you to access these rules either in PDF format or on the site of the Texas Register. The Texas Register site is the easiest way to navigate the State Board rules online. There, you will be taken to the appropriate section of the Texas Administrative Code. Specifically, we will be working and learning from Chapter 108, Professional Conduct. Click on the link for Professional Conduct and it will take you to this page, and we will be focusing specifically in Subchapter A, Professional Responsibility. Within this Subchapter A, Professional Responsibility of Chapter 108, Professional Conduct, you will find this table of contents page for the rules that regulate your license in day-to-day dental practice. For the purposes of this presentation, we will be focusing specifically on Rule 108.8, Records of the Dentist. Rule 108.8, Records of the Dentist. Subpart A. The term dental records includes, but is not limited to, identification of the practitioner providing treatment, medical and dental history, limited physical examination, oral pathology examination, radiographs, dental and periodontal charting, diagnosis made, treatment plans, informed consent statements or confirmations, study models, casts, molds, and impressions if applicable, cephalometric diagrams, narcotic drugs, dangerous drugs, controlled substances dispensed, administered or prescribed, anesthesia records, pathology and medical laboratory reports, progress and completion notes, materials used, dental laboratory prescriptions, billing and payment records, appointment records, consultations and recommended referrals, and post-treatment recommendations. A few things to point out about Subpart A of Rule 108.8 include, first of all, Subpart A of Rule 108.8 does not contain any of the words shall or must. It does not say the dental records must include the following. That is not the purpose of this subpart of the rule. Rather, this subpart of the rule, 108.8 Subpart A, identifies what is considered to be part of a dental record if it exists. In other words, you are not required to have each and every item listed here in a dental record. A dental record may not and most likely will not include all of the items listed here. However, if any of the items listed here exist, then certainly the rule states that the dental record is considered to be whatever that item is or include whatever that item is. There will be other subparts of the rule that identify what must be in the record. However, this part of the sub-rule only defines what is considered to be part of a record or in the dental record if it in fact exists. I haven't highlighted study models, casts, molds, and impressions if applicable. The reality is most dentists do not keep dental impressions and may not keep study models, casts, or molds, particularly if they are working models or lab models. The dental board understands and does not expect you to keep every single lab model that may come back from the lab or impressions that you may have utilized to create those models. Again, if these items exist and if you have saved them for some reason, they are considered to be part of the dental record. From a risk management perspective, I can tell you from experience, over the years, I have had clients who in fact did save their study models and in some instances, molds and impressions on a per patient basis. And those items, those models and impressions actually worked to successfully defend a doctor in a state board investigation of a complaint. So it's a comfort level item, and it's also something that's not necessarily required. However, if you do have them, they are considered part of the dental record and may very well work to help you defend any type of complaint from a patient. I have also highlighted dental laboratory prescriptions, mostly to point out that these are considered to be part of the dental record. I've seen many charts and dental records over the years where for some reason the doctors did not include a duplicate or a copy of their lab prescriptions within the dental record itself. Rather, they would just send one original to the lab and either not get it back or throw it away once the item that was prepared by the lab was completed and seated and delivered. Dental laboratory prescriptions, once they are created, are considered part of the dental record and should be, at a minimum, a duplicate kept within the record itself. The same would be said about appointment records. Even though you would keep appointments in a separate log or a separate area within your office, any type of record or log that keeps track of patient appointments is also considered part of the dental record. Rule 108.8, Records of the Dentist, Subpart B. A Texas dental licensee practicing dentistry in Texas shall make, maintain, and keep adequate dental records for and upon each dental patient for reference, identification, and protection of the patient and the dentist. Records shall be kept for a period of not less than 5 years from the last date of treatment by the dentist. If a patient was younger than 18 years of age when last treated by the dentist, the records shall be maintained by the dentist until the patient reaches age 21 or for 5 years from the date of last treatment, whichever is longer. Dentists shall retain records for a longer period of time when mandated by other federal or state statute regulation. With respect to this main part of Subpart B, first of all, this is the state board rule that absolutely makes it clear that you must not only make and maintain and keep dental records, but by definition they must be adequate. And adequate has been defined and interpreted by the board to be diagnostic quality for anything radiographic or pictorial, as well as legible for anything that's in writing. The dental records are kept for each dental patient for reference, identification, and protection of the patient and the dentist. Therefore, the State Board Rule 108.8 is specifically stating that records serve two purposes. One, protection of the patient, but also protection of the dentist. Dentists should understand that dental records, the more complete, the more adequate, the more information that's kept there, it's not only protecting the patient, the information relative to the patient and the patient's treatment, but it is also protecting you, the dentist, from any misunderstanding or any clarification that needs to be made in the future should there be a patient complaint or question, or even for handing off the patient or referring the patient to a subsequent treating provider. There's a lot of misunderstanding of the next part of the rule, and sometimes there's no understanding at all of how long to keep a dental record or how long the law requires a dentist to keep a dental record. Specifically, dental records shall be kept for a period not less than 5 years from the last date of treatment by the dentist. Many dentists will ask or inquire about when may I destroy or otherwise not have a dental record in my office. What's the length of time? 5 years, but 5 years measured from what period of time? The point in time that you measured this 5 years from is the date of the last date of treatment. That would go for adult patients, but if a patient is younger than 18 when last treated by the dentist, then you have to do a little bit of math. You have to determine which is longer. Do we keep and maintain these records until the patient reaches 21? And therefore, if they're 14 years old, and it will be until they are 21, would be 7 years? Or is it that they are 17 years old and it was be for 5 years from the date of last treatment, whichever is longer? Well, obviously, if they're 17, it will only take them 4 years to get to age 21, but now the rule kicks in. They're under 18. It needs to be for 5 years or until they're 22, because 5 years is longer than the period it will take them to reach the age of 21. So you have to do some math if they're under 18 years of age, but the rule specifically details exactly how to calculate that. As far as the other federal and state statute or regulation, I'm not aware of any, but that part of the rule is allowing for the possibility that that may occur from time to time. It's important to understand, and this rule at a minimum is a 5 year from the last date of treatment rule, and if the patient is under 18, understanding the math to figure out how long to keep those records. Moving on then, getting into the part of the rule that specifically tells you what must be included in the records of the dentist. Records must include documentation of the following. Subpart B, continuing from Rule 108.8, Records of the Dentist, states records must include documentation of the following: patient name, date of visit, reason for visit, vital signs including but not limited to blood pressure and heart rate when applicable in accordance with Rule 108.7 of this title, and number 5, if not recorded, an explanation why vital signs were not obtained. These first 5 items listed in Subpart B of what must be included in documentation in a records of a dental patient are what I call the common sense information items. Certainly, every record, whether the rule told you that you must have these items or not, should include at a minimum the patient's name, the date of each visit, and the reason for each visit. Then the rule goes on to incorporate the requirement found in Rule 108.7 that a dental record must keep or must record vital signs, including but not limited to blood pressure and heart rate. These are requirements that are specifically found in Rule 108.7 of the State Board Rules, and that rule is entitled Standard of Care. It is the standard of care, and it is cross-referenced in Rule 108.7 to keep these vital signs records as part of your dental record for each patient. In other words, it's not only a requirement for the records to include these vital signs, but the dental board considers it to be a standard of care item pursuant to Rule 108.7. I can tell you also from experience that over the years, it's amazing the number of records that I've seen that do not have either the patient's name or the date of visit or an adequate description of the reason for the visit or some combination of those first 3 items. As for patient name, it's important to have the patient's name recorded on each individual page, front and back of a dental record. I have had cases over the years where the licensee or the dentist who was defending themselves in a patient complaint were disciplined for not having the patient name on each page of their record. It doesn't say that or require it in the rule, but it is interpreted that way by the dental board and the State Board of Dental Examiners. The same would go for the date of visit. Each time that you make an entry, make sure that the date of visit and the date of the entry is recorded. And certainly, as for number 3, the reason for the visit needs to be adequately expressed so that anyone reading the record, particularly the subsequent treating dentist or the patient or a dental board investigator or the dental board themselves, would understand exactly what happened at each individual visit and what the focus of each visit was. This goes back to the description in the first part of the rule that it must have an adequate description of any of the following. Certainly the reason for visit is part of the record that not only protects the patient, but protects the dentist as well. Rule 108.8, Records of the Dentist, Subpart C. Further, records must include documentation of the following when services are rendered: written review of medical history and limited physical evaluation. Number 2, findings and charting of clinical and radiographic oral examination. Subpart 2A, documentation of radiographs taken and findings deduced from them, including radiographic films or digital reproductions. Subpart 2B, use of radiographs at a minimum should be in accordance with ADA guidelines. Subpart 2C, documentation of the findings of tactile and visual examination of the soft and hard tissues of the oral cavity. Again, this lists out additional items that must be included in the documentation of the records of the dentist. With respect to Subpart C1, written review of medical history and limited physical evaluation, this is directly from Rule 108.7, Standard of Care, which specifically requires, in accordance with Rule 108.8, that a record of the dentist include an initial medical history and limited physical evaluation, which is defined as blood pressure and heart rate. So there's a little bit of redundancy in the rule, but again, think of it as emphasis that every dental record must have a medical history, which must be taken at the first appointment and updated as often as a reasonable and prudent dentist would do so, pursuant to Rule 108.7, as well as the limited physical evaluation, which has defined in 108.7 as blood pressure and heart rate. As for Subpart C2, A, B, and C, findings and charting of clinical and radiographic oral examination. First of all, findings and charting of clinical oral examination, although it doesn't use the word periodontal examination, has been interpreted and understood and enforced by the board to include periodontal charting. In other words, the State Board of Dental Examiners, nearly 100% of the time in analyzing dental records, will look to find and see if, in fact, the dental record includes some level of periodontal charting and refer to Rule 108.8 Subpart C2 as the basis for the requirement to have periodontal charting included in the dental record for each patient. My advice, given my experience over the years, is to do and have and record the pocket depth charting that you would for any periodontal involved patient, regardless of their level of periodontal involvement. Those in great periodontal health, it will be evident from the charting, and those who are not, those are the patients that in all likelihood will have additional treatment that could result in a patient complaint. Over the years, I've seen a lot of doctors who were defending themselves against a state board complaint and investigation be reprimanded or disciplined for not having periodontal charting, even though all of their other record keeping was in compliance. With respect to radiographs, Subpart A, radiographs taken and findings deduced from them, the State Board in your records is looking for not only the radiographs themselves, which arguably the interpretation of those radiographs should show and be an example, or by their very nature depict or articulate what those findings are. This particular part of the rule has been interpreted and enforced by the dental board to the level that you must record in the progress notes what your findings are and what you have found in the radiographs that have been taken. You must write it out literally in the progress notes or somewhere in the chart what can be deduced or seen within the radiographs that have been taken. Certainly, Subpart 2B, radiographs should be in accordance with ADA guidelines. In other words, radiographs need to be taken within the standard of care for radiographic images. Over the years, I've seen a lot of records submitted to the board through an investigation of a complaint that were not compliant because they were not to the standard of care for radiographic images. Lastly, Subpart 2C, documentation of the findings of tactile and visual examination of the soft and hard tissues of the oral cavity. My recommendation is that you specifically have a line item for your clinical examinations that specifically says tactile and visual examination of the soft and hard tissues revealed the following findings, and either there will be some or which you would describe, whether it be oral cancer lesions or some other finding, or that you found nothing remarkable, only healthy tissue, but at least demonstrate your knowledge of the rule and with the expression or the statement that tactile and visual examination of the soft and hard tissues revealed the following. And then whatever that description may be, whether it be healthy or otherwise. Rule 108.8, records of the dentist, Subpart C, continuing further, records must include documentation of the following when services are rendered. And this is the longest list of items that must be in the record beyond what has already been discussed on the previous two slides. In the progress notes and in the dental record, you must include this list of items or items that address this list of requirements. The diagnosis, treatment plan recommendation and options, the treatment provided, medication and dosages given to the patient, complications, written informed consent that meets the provisions of Rule 108.7, Subpart 7, the dispensing, administering, or prescribing of all medications to or for a dental patient shall be made a part of a patient's dental record. The entry in the patient's dental record shall be in addition to any record-keeping requirements of the DPS or DEA prescription programs. All records pertaining to controlled substances and dangerous drugs shall be maintained in accordance with the Texas Controlled Substances Act. Confirmable identification of the provider dentist and confirmable identification of the person making record entries if different from the provider dentist. And finally, when any of the items above in 1 through 11 of this subsection are not indicated, the record must include an explanation of why the item is not recorded. So, to review, records must include documentation of the following services when they are rendered. The diagnosis. You must have a clear, descriptive statement as to what the diagnosis is from your clinical and radiographic examination. Then, Subpart C4, your treatment plan should not only have what the decided, determined, and agreed upon treatment plan going forward will be, but also statements with regards to what recommendations were made to the patient in determining that treatment plan, and when applicable, any and all options for treatment that were presented to the patient so that they could consider all of the options available before deciding and agreeing upon the final treatment plan. In my experience with investigations and board cases over the years, it is this particular detail, the lack of a description of recommendations and or options that were stated by the doctor to have been discussed but not recorded in the records, and that particular lack of information, the lack of the recommendation and options, is exactly what was the basis for a finding of a violation or non-compliance with state board rules. It's important to, either in the progress notes or a separate page, to have written down and articulated the recommendations and options that led to the final agreed treatment plan. Certainly, number 5, the treatment provided, the actual treatment provided pursuant to that treatment plan needs to be recorded in the records of the dentist, and it needs to be as descriptive as possible. Certainly, if there's a change or an alteration of the treatment plan, some description here in the treatment provided of what treatment was actually given, but also the reasoning of why it altered or diverted from the original treatment plan. And certainly that may get into whether or not that change was discussed adequately with the patient, and if the patient gave informed consent as to that change. Medication and dosages, complications, and then written informed consent in compliance with Rule 108.7, Subpart 7 of this title. Again, this is an example of where Rule 108.8 and Rule 108.7 dovetail to have mutual requirements with respect to not only medical history, blood pressure, and heart rate, but also written informed consent is required by both rules. Just a short review of the discussion with regard to informed consent. Informed consent must be in writing, it must be signed by the patient, and it must be descriptive of all of the considerations with respect to alternative treatment and the risks and hazards associated with treatment that would assist the patient in determining whether or not to consent to that treatment. The advice given for informed consent is that it is a discussion between the doctor with the experience and education and expertise to discuss the details of informed consent with the patient, and making sure that all of their questions are answered and that they're clear on what to expect when giving informed consent. The dispensing, administering, or prescribing of all medications and all records pertaining to controlled substances and dangerous drugs. Both of these items clearly state that any time that you write prescriptions, and particularly anything pertaining to controlled substances, must be included within the records of the dentist. Subpart C11, confirmable identification of the provider dentist, would be the dentist's name or initials. Sometimes different offices use a doctor number, but some way to identify the provider dentist in an affirmative way that can be confirmed. You must, in other words, bottom line, you must sign off on each entry, or at least have yourself identified as the providing dentist for each entry. And then a confirmable identification of the person making the record if different from the provider dentist. In other words, if any particular entry in a progress note is being entered by the dental assistant, then the dental assistant must not only identify who the provider dentist was for the dental treatment, but also must identify themselves as the person making the record entry. And finally, Subpart C12, if the record does not include any of the items above in C1 through 11, then the record must include an explanation of why the item was not recorded. Remembering that these are items 3 through 11, and then 1 and 2 were the medical history, the blood pressure and heart rate, and the findings and charting of the clinical and radiographic examination, and then continuing 3 through 11. And if any of these items are not recorded, you must include an explanation of why the item was not recorded. For example, a patient may refuse to have radiographs. Then you would specifically write out, patient refused radiographs. A patient, for whatever reason, you may not be able to obtain their blood pressure and pulse in any particular appointment where it might be required. Then you must give an explanation in the records of why you did not obtain the blood pressure and pulse as required by the rule. Simply state whatever the reason is, but understand that that too is a requirement of the rule. If anything required is not stated, then you must put an explanation of why it is not there. Rule 108.8, Records of the Dentist, Subpart D. Dental records are the sole property of the dentist who performs the dental service. However, ownership of original dental records may be transferred as provided in this section. Copies of dental records shall be made available to a dental patient in accordance with this section. So, the introduction to this Subpart D specifically says that dental records are the sole property of the dentist who performs the service. And then in the last sentence, copies of dental records shall be made available to a dental patient in accordance with this section, which we'll talk about in a moment. But in the second sentence, the rule also allows for the fact that it is very common within the profession of dentistry, particularly in Texas, for instances for dental records to be transferred. And this part of the rule, Subpart D, identifies 3 different ways to transfer the records in compliance with board rules. Subpart E then goes into those details. A dentist who leaves a location, whether by retirement, sale, transfer, termination of employment, or otherwise, shall maintain all dental records belonging to him or her, make a written transfer of records to the succeeding dentist, or make a written agreement for the maintenance of records. So Subpart D, the second sentence above, says ownership of the original dental records may be transferred as provided in this section. And then Subpart E is the subsection that identifies 3 different requirements depending on the situation of any individual dentist. You either maintain the records, or you make a written transfer of the records, or you make a written agreement for the maintenance of those records. And then, continuing, Subpart E goes into the details of each one of these 3 different options. Rule 108.8, Subpart E1 states that a dentist who continues to maintain the dental records belonging to him or her shall maintain the dental records in accordance with the laws of the state of Texas and this chapter. If you'll recall, earlier in this rule, Rule 108.8, the requirement was that you maintain the records for a period of no less than 5 years from the last date of treatment. So if you're going to maintain a record, you need to know the length of time, and certainly in accordance with any privacy laws as well. This is one option with respect to the maintenance of records, is to maintain them yourselves according to the state law, which would be 5 years at a minimum from the last date of treatment. Subpart E2 discusses the making of a written transfer of records. A dentist who leaves a location or practice, whether by retirement, sale, transfer, termination of employment, or otherwise, etc. Subpart 2, a dentist who enters into a written transfer of records agreement shall notify the State Board of Dental Examiners in writing within 15 days of a records transfer agreement. The notification shall include, at a minimum, the full names of the dentists involved in the agreement, include the locations involved in the agreement, and specifically identify what records are involved in the agreement. The agreement shall transfer ownership of the records. A transfer of records agreement may be made by agreement at any time in an employment or other working relationship between a dentist and another entity. Such transfer of records may apply to all or any part of the dental records generated in the course of the relationship, including future dental records. A dentist who assumes ownership of the records pursuant to this paragraph shall maintain the records in a manner consistent with this section and is responsible for complying with subsections F and G of this section. So, with respect to a written transfer of records agreement, typically this can be a standalone document entitled a written transfer of records agreement, or it can be a subparagraph that would be found in a asset sale or purchase agreement for a dental practice, basically the contract for a dental practice office sale or purchase. This can be a written transfer of records paragraph or subsection or section in that contract that details this information, to include full names of the dentist, which obviously will be in that contract, the location involved in the agreement, in other words, where the records are held, and identify the records that are involved in the agreement, which typically would be accomplished by attaching an exhibit of the entire patient list to that sale agreement. You can also have a written transfer of records agreement in an employment contract, because it will be in an employment situation where the treating dentist, as the employee, at some point will terminate that employment and move on from that dental practice. And most employment contracts between dentists specifically state and have a paragraph or section that states that the records involved in that employment relationship will remain with the practice and the practice owner, and the departing employee will have access to those records pursuant to the same Rule 108.8. A paragraph or section in an employment agreement can be written in such a way, again, to be compliant with this Rule 108.8 subsection E2, to give all of the information. What is oftentimes missed in this particular rule is that you must notify the State Board of Dental Examiners in writing within 15 days of a records transfer agreement. So, whether it's a standalone agreement, in other words, not part of a contract but just simply a written transfer of records, you must notify the State Board of Dental Examiners in writing within 15 days of the records transfer agreement, or in the case of a sale agreement, you must notify the State Board of Dental Examiners in writing within 15 days of a records transfer agreement, which would be to notify them of the sale of the practice and including the information described here in the rule in that notice to the board. The third, the employment agreement, I would say that the employment agreement or the termination of employment and any records transfer there, again, you must notify the State Board that you no longer work at a particular place of employment, but the records for the treatment that you've rendered remain at your previous place of employment. This is probably something that's overlooked by most dentists when they move on from a place of employment, as they don't notify the board that the records of patients that they treated are going to be staying with their previous employer. Technically, under the rule, that would be required. Subpart E3 of Rule 108.8 contemplates the option of making a written agreement for the maintenance of records. A dentist who enters into a records maintenance agreement shall notify the State Board of Dental Examiners within 15 days of such an event. The notification shall include the full names of the dentists involved in the agreement, the locations involved in the agreement, and shall identify what records are involved in the agreement. A maintenance agreement shall not transfer ownership, but shall require that the dental records be maintained in accordance with the laws of the state of Texas and the rules of the State Board of Dental Examiners. The agreement shall require that the dentist performing the dental services recorded in the records have access to and control of the records for purposes of copying and recording. The dentist transferring the records in a records maintenance agreement shall maintain a copy of the records involved in the records maintenance agreement. Such an agreement may be made by written agreement by the parties at any time in an employment or other working relationship between a dentist and other party. A records maintenance agreement may apply to all or any part of the dental records generated in the course of the relationship, including future dental records. So the rule specifically states that a maintenance agreement shall not transfer ownership, but shall require that the dental records be maintained in accordance with the laws of the state of Texas and the rules of the State Board of Dental Examiners. So the difference between a written transfer of records, there is a specific transfer of records in the ownership of records to a new owner of the records, a new owner of the practice, or specifically back to the owner of a practice in an employment situation. This is distinguished from a written agreement for maintenance of records, where records of the treating doctor are left and maintained at a previous place of employment or previous place of ownership even, but there's no transfer of those records. The ownership of records remains in the original treating doctor. That's the main distinguishing difference between a written transfer versus a written agreement for maintenance. One is to physically or transactionally transfer ownership, whereas the other is merely arranging for the maintenance of records at a particular location. If this is the type of agreement that you have to have pursuant to this rule, again, it's important to notice and comply with the requirement to notify the State Board of Dental Examiners of that agreement, so that when a dentist leaves a location, retirement, sale, termination of employment or otherwise, and they enter into a written agreement for maintenance of records, the State Board not only wants to know where they can find you, which you'll, as the dentist, which you'll be notifying the board of any address change, but also where to find the records of patients that you treated and where are those records being maintained. Rule 108.8, Records of the Dentist, Subpart F. Dental records shall be made available for inspection and reproduction on demand by the officers, agents, or employees of the State Board of Dental Examiners. The patient's privilege against disclosure does not apply to the board in a disciplinary investigation or proceeding under the Dental Practice Act. Copies of dental records submitted to the board on demand of the officers, agents, or employees of the board shall be legible, and all copies of dental x-rays shall be of diagnostic quality. Non-diagnostic quality copies of dental x-rays and illegible copies of patient records submitted to the board shall not fulfill the requirement of this section. This is the rule that regulates a dentist's license in Texas, which specifically states that the dental board is entitled on demand to a copy of any dental record. You must make them available upon demand for inspection and reproduction by any officer, agent, or employee of the Dental Board of Examiners. With respect to any requests for dental records from a dental board officer, agent, or employee, usually that request comes in writing, and usually it comes associated with an investigation of a patient complaint. Sometimes this request might be made in person. An investigator for the State Board of Dental Examiners may show up at your office unannounced, and it's important to know that whatever they're asking for with respect to records, they do not have to have a subpoena, they do not have to have anything in writing. Simply to be able to state that they are an employee of the dental board or acting on their behalf is enough to trigger the rule that you must make available to them a patient record on demand and on request without any delay. My advice over the years is to always professionally and politely cooperate with officers of the State Board of Dental Examiners during any type of investigation, whether the investigation is noticed by letter in writing or in person by an investigator coming to your office. Please note the part of this subpart of the rule that states that your records must be legible and x-rays must be of diagnostic quality, and if they are not, then they will consider the x-rays or the notes to not be in compliance with the rule and could be a violation in and of themselves. Rule 108.8, Subpart G, records of the dentist. A dentist shall furnish copies of dental records to a patient who requests his or her dental records. At the patient's option, the copies may be submitted to the patient directly or to another Texas dental licensee who will provide treatment to the patient. Requested copies, including radiographs, shall be furnished within 30 days of the date of the request. The copies may be withheld until copying costs have been paid. Records shall not be withheld based on a past due account for dental care or treatment previously rendered to the patient. Copies of dental records submitted in accordance with a request under this section shall be legible, and all copies of dental x-rays shall be of diagnostic quality. Non-diagnostic quality copies of dental x-rays shall not fulfill the requirements of this section. To review 108.8 Subpart G, first of all, there is nothing in the rule that requires a dental patient to make their request for his or her dental records in writing. The mere verbal request, be it in person or over the phone or by email or any other means, the mere request triggers the timeline of the rule, and you must furnish the records to the patient within 30 days of the date of the request. You cannot require the patient to submit their request in writing, and you cannot require that the patient sign a receipt for the records. The advice is, at a minimum, you should try or attempt to have a patient acknowledge receipt of the records, but the inability to obtain a receipt for the records from the patient should not be what keeps you from complying with this rule. Simply put, the rule states that once a patient requests a copy of their records, you have 30 days to comply with that request. Another aspect of this rule that's often missed or violated by Texas dentists that I've seen is that they will not give a complete copy. This rule requires that you give a complete copy of everything that's considered part of the patient's record to the patient. It is not for the dentist to decide which part of the records that the dental patient is entitled to or needs. Rather, once a patient requests any part of their records, this rule requires the dentist to provide a copy or a duplicate of the entire record. Something to note on Subpart F as well as this Subpart G, never give an original of any part of a dental record to the dental board or to a patient. Both subparts F and G of Rule 108.8 merely require a copy or a duplicate, and you should always maintain the originals of dental records in your office. Again, never give or send original records of any sort, whether written, electronic, or radiographic or photographic, to the dental board or to patients. The dental board does not expect originals, they expect duplicates, and this part, Rule 108.8 Subpart G, only states that you have to furnish copies. There's nothing that requires that you give originals, and you should always maintain originals in your office. You cannot withhold records that have been requested by a patient from the patient and have the withholding of those records based on a past due account. If a patient owes money on a past due account, owes fees for dental care or treatment that has previously been rendered, you cannot withhold those records until that past due account is paid. The only thing that you can withhold records for is if they have not paid any copying costs for the duplication of those records. That can be the basis for withholding the duplicate of the patient records, but the payment on a past due account cannot be the basis for withholding duplicates of records from a patient. Certainly whatever that you submit to a patient must be legible, and x-rays must be of diagnostic quality. The failure to provide a patient with legible records and x-rays that are of diagnostic quality could in and of itself be a violation of this rule. With respect to the amount that you are able to charge by law for copying costs for the duplication of dental records, Subpart G of Rule 108.8 outlines the amount that may be charged for the furnishing of copies of dental records to patients. Subpart G, a dentist shall furnish copies of dental records to a patient who requests his or her dental records. Subpart G1, a dentist providing copies of patient dental records is entitled to a reasonable fee for copying, which shall not be more than $25 for the first 20 pages and 15 cents per page for every copy thereafter. Fees for radiographs, which if copied by a radiographic duplicating service, may be equal to actual cost verified by invoice. Reasonable costs for radiographs duplicated by means other than by a radiographic duplicating service shall not exceed the following charges: full mouth radiographic series, $15, panoramic radiograph, $15, a lateral cephalometric radiograph, $15, a single extraoral radiograph, $5, a single intraoral radiograph, $5. State agencies and institutions will provide copies of dental health records to patients who request them following applicable agency rules and directives. So, obviously, Subpart G limits the amount of fees or copying costs that you can charge a patient before delivery or furnishing of those dental records to the patient. This is part of the rule that must be strictly complied with. It's important for your dental office staff, who more than likely will be at least part, if not the sole person interacting with the patient with respect to these copying costs, understand this part of the rule. You cannot arbitrarily assess a number or an amount to the duplication of records, but the amount that is charged for duplication, whether it be by services or done in the office, must be based in this particular guideline for the charging for radiographic duplication. With respect to models, the rule does not articulate the amount to charge for the duplication of models. My advice has always been to either duplicate at no cost, which is certainly your option with radiographs as well, but certainly to not charge more than what is provided in the rule for radiographs, using that as a guideline or basis for what you might charge for the duplication of models. So that concludes Rule 108.8, Records of the Dentist. If you have any questions, if you need clarification with respect to anything that was discussed in this presentation and discussion of Rule 108.8 of the State Board of Dental Examiners rule with respect to records of the dentist, you may send an email to utsdcontinuinged@uth.tmc.edu. I will be happy to respond to any questions pertaining to this presentation. The text and references that were utilized in the production of this presentation came directly from the State Board of Dental Examiners website, specifically the State Board Rule 108.8, Records of the Dentist, which can be found at this website address. This completes Dental Practice Risk Management through Regulatory Compliance, Part 2, TSBDE Rule 108.8, Understanding and Implementing Proper Care of Records of the Dentist. It is time for you to take a short exam in order to complete the requirements for streaming video courses. Please make note of the following instructions.